I'm Dr Nicodemus Jr. I'm an internist-endocrinologist and I work at the Manila Doctors Hospital, Philippines. Insulin is a very important hormone that is produced by one of the major organs here in our abdomen, that's the pancreas. And it is a substance that is important in controlling the amount of sugar in our blood. What happens is whenever we eat, the pancreas increases its secretion of insulin, and as the insulin levels go up, it slowly brings down the sugar level from your blood so that it goes inside the organs where sugar is needed so that it becomes a source of energy. And so what happens is when you have enough levels of insulin, the blood levels of sugar are in the normal range. When you eat, it goes up slightly, but during the time that you're hungry, the insulin levels are also low. Insulin is usually needed by people who have a disease called diabetes mellitus. Diabetes mellitus is a disease wherein the insulin secretion of the body is either not enough or that the insulin has a defect. And therefore, if the number of insulin that is secreted by the pancreas is not enough, the sugar levels in the blood will go up. And if you have a defective type of insulin or its receptor is defective, it will not also act properly. And so what happens is after you eat a meal, instead of your blood sugar being just within a range that is called normal, it goes very, very high to levels that we call as diabetic ranges. There are several types of insulin, and nowadays, because of the technology, there are a lot of what we call as new generation insulin. The first types of insulin that happened more than 100 years ago, actually in 1921, the very first type of insulin that was obtained was from cows. And the very first recipient of the insulin was actually a dog who had diabetes mellitus. But then afterwards, when they started using cows' insulin to humans, they found out during those early days that it actually produces allergic reactions to humans. And so what they did was to transfer from cows to other sources such as pigs. But then, when we had commercial insulins, these are now not coming from animals but are actually coming from bacteria using recombinant DNA technology. So the very first medicinal uses of insulin that were purified really came from the human recombinant insulins, and these have been used for several decades until perhaps in the last decade wherein we already have what we call as the insulin analogs. When you say insulin analogs, these are insulins wherein the amino acids have been modified a bit from the normal human insulin amino acid structure so that one change or two changes in the amino acid sequence changes the property of the insulin. Either they make it longer acting or they make it shorter acting. And so as far as the modern insulins that we have now in the market, we still have the human recombinant insulins, but we also have the insulin analogs. When we talk of oral agents for the control of blood sugar in patients with diabetes, these are usually our patients with type 2 diabetes. And therefore, majority of our patients with type 2 diabetes start with oral agents on top of lifestyle intervention that should be placed together. So we advise them proper diet, increased physical activity, and then they take the tablets. But when do we need insulin? Insulin is usually needed when the levels of the sugar are extremely high. Aside from that, insulin will also be important when the patient has what we call as catabolic symptoms, meaning they continue to lose weight, they have weakness, they pee a lot, and because of this, their body is really in a state wherein it's really becoming weaker because of the elevated blood sugar. These are the types of individuals who would benefit with insulin as an early intervention, but then there's another subgroup of patients who really would require insulin, and these are the patients who have what we call as hyperglycemic crisis or hyperglycemic emergencies. These are people with extremely high blood sugars, and yet they also have high acid in the blood. Some of them have changes in their sensorium such that they are sleepy, and some even go into coma. these are the patients who are usually brought to the emergency room, and therefore, the initial treatment in order to bring down the sugar would be insulin, either in the form of a subcutaneous injection or even we provide insulin using the intravenous route. And so these are the patients who would really benefit from early insulin therapy, but the focus now, or even the paradigm in the treatment of type 2 diabetes has changed a bit over the last few years. Whereas before, we just gave patients several oral agents in order to control their blood sugar, there are studies now saying that if on initial diagnosis, the patient has high blood sugar and we want to preserve the beta cells which are secreting insulin, you can administer insulin in the first few months upon diagnosis of diabetes in order to bring the sugar back to normal, such that after a few months, when the insulin levels are already stable and the sugar levels are also normal, you can slowly remove the insulin and shift the patient to oral agents to control the diabetes. So that's now the paradigm shift that's happening over the last few years. From insulin being the last treatment, it is now considered as a very important first-line treatment, especially if you want to preserve the beta cells and hopefully have an individual with better controlled blood sugar so you can transition them to oral agents in the future. The body is such a very wonderful creation that what happens is after you eat a meal, within 5 minutes, the insulin levels in your blood rapidly rise to levels that are very high so that it can control the increase in sugar as you're eating. And then over the next 30 minutes to 2 hours, the level of insulin slowly goes down, and then there's another second phase wherein it slightly goes up before the second hour so that whatever extra sugar is there will still be controlled. Now, the initial insulins that were developed earlier on, those that came from bacteria, the human recombinant insulin, were not as fast when it comes to increasing the levels in response to a meal. And so whereas the normal insulin secretion would rise within the first 5 minutes, the human recombinant insulin would rise after around 30 minutes. So really there is a delay when it comes to the onset of action of the human recombinant insulin. And the action of the human insulin is very quick. It acts very fast, but within a matter of 1 to 2 hours, the action is gone. Whereas for the human recombinant insulin, they act slower at around 30 minutes, but then their action is longer, lasting for 3 to 4 hours. So there is that difference between the normal human insulin and the human recombinant insulin that we used to have in the market for several years. Good thing though is that with the insulin analogs, by tweaking the amino acids, they were able to come up with insulins that have onset of action as quick as our physiologic human insulin. So now we have insulins that are injectable that can act even as early as 5 minutes and can last for 1 to 2 hours. And these are our what we call rapid-acting insulin analogs. And another innovation that came out is that we now have what is called as the basal insulin. The basal insulin is the insulin that is present in the body all throughout the 24-hour period, which is able to control our blood sugar within a normal lower range. That is present in our body even when we're sleeping. And with the insulin analogs, they were able to develop a flat insulin that can act more than 24 hours, simulating the normal human basal insulin secretion. So that's the beauty with the newer insulins now. They are able to simulate the onset of action, the duration of action, and even the pattern of action of our own physiological insulin. The good thing is that technology does not stop. And what we have right now in terms of the insulin analogs are our rapid-acting insulin and our basal insulin. But in the near future, there are already developments that we will have an ultra-fast-acting insulin even faster than 5 minutes. And we will also have the ultra-long-acting insulin Whereas before, the insulin analogs just last for around 24 hours. Now we have insulins that last 36 hours, and in the future, instead of injecting insulin once a day, you only need to inject it once a week because of the long-acting insulins that are in development right now. So really, because of technology and all of these, in order to answer the problems of prior insulins, we are now developing more modern and more friendly insulins.